So bone marrow transplant is a therapy that can be used for some patients with chronic granulomatous disease. The process of bone marrow transplantation involves replacing the bone marrow and the immune system of the patient receiving the transplant. In the case of chronic granulomatous disease, it is a deficient immune system or white cells that are important for fighting infection that do not work well. Through bone marrow transplant, we're able to replace the patient's own bone marrow and immune system with the bone marrow and immune system from a donor whose white cells work correctly, have normal oxidase activity, and would be able to eliminate any infections that the patient may have. Although bone marrow transplant is curative of chronic granulomatous disease, or CGD, we do not use this modality for all patients. With bone marrow transplantation, there are a lot of risks that are involved that can place the patient at risk for complications. The decision of which patients need to go to bone marrow transplant with chronic granulomatous disease requires discussion between the patient and the multiple specialists, including the bone marrow transplant physician, to decide if bone marrow transplant is really the best option for patients with chronic granulomatous disease.
When we think about bone marrow transplant and its risks and benefits, I think we have to think about a few things. We have to think about the status of the health of the patient who's going to be getting the bone marrow transplant. We have to think about what the donor options are that we have available to us. Certainly we see the best outcomes across the board in almost every form of transplant if the patient has a matched sibling donor available. And then coming in as a close second is when there are matched unrelated donors, either adult unrelated donors who are full matches or cord blood unrelated donors who are full matches. I think it becomes a little more tricky when there's nobody who's a full match to the patient and we have to consider using a half-matched relative, which would typically be a parent, because our risks of graft versus host disease, the more we're mismatched, can become higher.
Bone marrow transplantation in CGD has come a long way. As recently as 10-15 years ago, it was really considered an experimental therapy for CGD, and now especially for X-linked CGD, it is considered the standard of care. For bone marrow transplantation, the success rate of bone marrow transplantation is dependent on a number of factors. The first factor is finding an appropriate match. So if a patient has a full sibling, they have a 25% likelihood of being a full match. And the better the match, the better the outcomes. Number two, the older the patients are, the less likely the transplant is to be successful. And that is typically due to a number of factors, including permanent end organ damage that results from recurrent infections the longer you wait.